Tom is currently the Bureau Chief for the Bureau of Managed Healthcare at the Agency for Healthcare Administration. He's a graduate of Central Michigan University, a certified public accountant registered in Michigan, and he has regulated managed care organizations providing healthcare coverage and benefits for private and government-sponsored programs in the state of Florida for the past 20 years. Very experienced, very knowledgeable. First met him in Orlando at the Florida Association meeting, Realtors meeting, and we knew that we just had to bring him down so our members down here can bring the good information that he has for us. So with that, Tom Warren.
So there's another first for me. A couple of things I want to do first, and I'm hopefully going to mention it to you before you can. If anybody has any questions about this program that I can't answer today, or you talk to your friends or whatever, and they have questions that can't be answered by the website, I'm going to give you a phone number. It's 850-487-0640. That's into the Bureau of Managed Healthcare at the Agency for Healthcare Administration. We have a team of folks up there whose sole responsibility is to oversee the Cover Florida program. So, legislative overview. Whoa, boy, that does work. Okay. Basically, the governor and the legislature, availability and affordability of health insurance has been an issue for a long time. And one of the, everybody recognized it, and last year the governor and the legislature worked together to come up with a private sector plan. We didn't want to try and build another government program. That's kind of not the philosophy in Tallahassee. And so they tried to come up with a way to provide a private sector healthcare product that was more affordable, providing basic benefits. This is not the Cadillac, or, well, I don't know how much longer Cadillacs are going to be around, but the Rolls Royce of health insurance. It's meant to provide basic coverage to folks who are not currently insured. And I know that has caused a lot of folks a lot of problems. But one thing that the governor and the legislature try to do when they look at programs such as this is not disrupt the current marketplace for folks who already have insurance. This program is basically targeted at folks who don't have coverage or who are about to lose coverage. And one of the things that we mention up here is the Health Flex program that was passed in 2003. That was part of Governor Bush's healthcare initiative. It was one of the things that was passed during that legislative session. The problem we found out with Health Flex is, number one, it was such a stripped down model of coverage that nobody would buy it. And some of the eligibility restrictions on it were such that many of the, well, all the insurance carriers in the state of Florida chose not to participate in the program. It has started to take off in the last couple of years, and in the same legislation that Cover Florida passed, there were some changes to Health Flex, so that program will be changing as well. What we were trying to do was get folks out of the emergency room. One of the most expensive places for people to get health care in a non-emergent situation is in the emergency room. And this product is designed to give folks an alternative place other than the emergency room to get care and to have a medical home. Eligibility. It's the policyholders, we're targeting 19 to 64 years old. Some of the plans do offer coverage for dependents. We tried to structure it so that, like I said, the policyholder is between 19 and 64. So if the policyholder has spouse, children that qualify, some of the Cover Florida carriers do provide a family type of coverage. You also are not covered currently by private insurance. You're not eligible for Medicare, Medicaid, Kid Care, Medikids, Healthy Kids, any type of government program. You apply to the Cover Florida entity and you pay your premiums. Not covered for the last 6 months. I know that kind of turns a lot of people off, but again, remember the basic purpose of this program was targeted for those folks who currently do not have any health insurance coverage. So one of the things they have to be careful of when any type of legislation is passed is not to decimate the rest of the marketplace. This is to be in addition to. It's not a replacement for. We like to think of it as a stepping stone from no coverage to Cover Florida, and hopefully in the next few years when the economy gets going better and employers start offering coverage again, this will be a bridge. Well, thank you. We just went through this slide. Okay, there was another gentleman that had asked me about pre-existing conditions. This policy is a guaranteed issue policy, which means if you qualify and you apply and you pay your premium, the Cover Florida plan has to issue you a health insurance policy, a Cover Florida policy. What they can, because they can't underwrite this, which means they can't, if you had the gentleman explained to me he had a fairly significant illness 15 years ago. He's found difficulty with getting individual coverage on his own because of his prior health history. That's health underwriting, okay? That's not allowed with the Cover Florida program. The policy has to be issued. Now what they can do is exempt pre-existing conditions. And pre-existing conditions for purposes of Cover Florida are any diagnosis or treatment which you have had 6 months prior to the effective date of your policy can be excluded from coverage for 12 months. Then after that 12-month period is over, then they have to cover you for whatever. So if you've had cancer 5 years ago, if you've been diagnosed with anything 5 years ago, they can't pre-ex you on that for pre-existing conditions. However, if you've had any treatment for any illness in the prior 6 months, then they don't have to cover that for 12 months. After the 12-month period is over, they have to cover every benefit in accordance with the terms of their policy. Cover Florida plans are portable. When you change jobs, you don't have the issue with my employer moving from one employer to another. That policy belongs to you. So wherever you go in the state of Florida, that policy goes with you, as long as you continue to pay your premiums. The other thing is that we have also been advised by the federal government that the Cover Florida programs do in fact provide you with creditable coverage. So if you have a Cover Florida policy for 18 months, you move out of state, what you need to do is get a certificate from your Cover Florida plan. And when you go to, if you move to North Carolina, Georgia, Tennessee, wherever, you can get a policy issued, an individual policy issued to you because it's creditable coverage under HIPAA. So that's another benefit.